Hello, everyone, and thank you for joining me today. My name is Leslie Murphy. I am the acupuncturist and owner of Balanced Health Acupuncture in Cornelius, North Carolina. In today's presentation, I'm going to introduce you to what acupuncture is, in case you're not familiar with the medicine, talk a little bit about my credentials and why you might want to see me for your acupuncture treatments, and then also end with how you can get in touch with me to either schedule an appointment or learn more in case there's something I didn't cover in today's presentation. So let's kick off with what is acupuncture? Acupuncture is a 2,000-year-old form of medicine that's used worldwide, both as a primary and a complementary form of treatment. So you can feel or rest assured that this is not like the latest fad that some influencer is trying to convince you to use. It's a form of medicine that's been around and has stuck around because of the test of time that it works and has helped people. But even if you know nothing really about the medicine, you probably know that it does involve needles. So let's address that elephant in the room first. So when you think of a needle, your mind probably first goes to a hypodermic needle that you might find in a traditional doctor's office. Well, acupuncture needles are not hypodermic needles. Hypodermic needles are um, thick and hollow, right? Because they have to either push something into the skin or into the body or pull something out. So I don't really like those either. But acupuncture needles, in contrast, are very, very thin and flexible. They're about, the size like of a human hair. They're all single use, used, on somebody once and put in the biohazard. And only a select number of points are used. So you don't have to conjure up an image of like the Hellraiser movies, right? You're not going to be covered with acupuncture needles. Um, but because it does, you need use needles. The number one question is, does it hurt? And the simple answer is no. Acupuncture should not hurt. The most common phrase I hear with new patients is, "Oh, I didn't even feel it," and that's exactly right. Nothing should feel sharp, painful, or pinchy. It's actually just a really nice and relaxing form of treatment to help yourself. So, if it uses needles, what exactly is it doing in the body? And there's no one explanation to how acupuncture works, which is actually a very good thing because it does a wide range or influences the body in a wide range of areas, including increasing circulation, reducing inflammation, regulating hormones, releasing pain relieving endorphins, reduces stress and cortisol, and regulates the immune system. And that's just, the tip of the iceberg of what it really does in the body. So, because it can influence the body in so many different ways, it can treat a lot of different things. Pretty much any physical and or mental emotional symptom that you're experiencing from head to toe. Most people might only think acupuncture treats pain symptoms or anything only affecting the musculoskeletal system, which obviously it does. I see a lot of people with neck pain, shoulder pain, back pain, knee pain, and the like, but it really treats much more than that. Um, I commonly see and treat headaches and migraines, allergies, and any type of immune support, digestive conditions, IBS, diverticulitis, constipation, you name it, insomnia and sleep conditions, people who have trouble falling asleep or wake frequently, have night sweats, stress and anxiety and depression, treat a lot of mental and emotional problems, as well as menstrual problems and menopause symptoms. So, why do people love getting acupuncture? And I'll hit some of the main highlights here. One, because it is a whole body approach, right? We don't separate the physical, mental, and emotional in traditional Chinese medicine. It's all often related, where the physical can impact your mental and emotional symptoms and vice versa. Like your mental and emotional stress can also impact what you're feeling physically. And so we can work on both at the same time during your treatment. And, in traditional Chinese medicine, one size doesn't fit all, right? You might go to a doctor's office and they hand out the same medicine for everyone who comes in for a headache. Where really, I with acupuncture, you're getting a truly individualized treatment, right? I ask a whole host of questions in my health history form, and when we meet together, because my job is awesome. It's like putting together a puzzle, right? All these symptoms that we might uncover in our intake, you might think are very unrelated, but really in traditional Chinese medicine, they they are related. And by asking all those questions, it can help me identify the root cause of the illness, and that's what we're going to be treating um, with your acupuncture treatment. So it's not a band-aid approach, right? We really want to get to the root cause of why you're the cause of your symptoms that you're experiencing. But probably the number one reason that I hear a lot why people love acupuncture is because they're not looking for a new medication, right? They want a more natural approach that doesn't involve popping a new pill or using any chemicals. Um, and because of that, acupuncture does not have any negative side effects, which is wonderful. If anything, it has lots of positive effects. Um, Meaning relaxation and just feeling a lot more calm. And a lot of that is due to the acupuncture nap that you get each treatment. Um, I really encourage people just to relax and snore away. Um, and that's probably one of the best benefits of getting acupuncture. So, what is a typical session like? I do ask or have new patients fill out a comprehensive health history form, which in our first treatment we go over thoroughly, but I also give people really a enough time to share their story, right? That's a big part of it, to talk about why they're there, what symptoms that are impacting their life. Um, and just have that opportunity to share. And then I walk through what to expect, especially if it's their first time, so they understand what acupuncture is all about, and then give them a full treatment where, as I said, they're just up on lying on a massage table, fully clothed, um, with just a few needles, and lie back, take a nap with some relaxing music and warm heat lamps and the like. So I've talked about acupuncture, but who am I and why might you want to come see me for treatment? Again, I'm Leslie Murphy. I am a Davidson graduate, and after graduating Davidson, I moved up to Boston, where I worked in the nonprofit sector, and I also received my master's in social work from Boston College. Um, After that, I ended up working in higher education and ended up struggling with my own chronic pain injury, which led me to going back to acupuncture and using that for myself to help heal me of my chronic pain injury, and realized that the New England School of Acupuncture was there in Boston. I said, I love this medicine. I love working people. It's a great fit. So attended school there and graduated and opened up my own private practice there outside Boston for about 12 years. But then we moved here to North Carolina at the end of 2021 to be closer to family, and then I opened up my practice in Cornelius in January of 2022. So I share my story a lot, which I didn't really get into, about my own chronic pain issue. And I can say now, in hindsight, that going through that was honestly the best thing to happen to me, which prompted me to go to acupuncture school and changed my life in the best way, because now I love helping people who might be struggling with the same thing. So my credentials, I do have my master's in acupuncture from the New England School of Acupuncture. I'm licensed by the North Carolina Licensing Board, nationally certified by the National Certification Commission for Acupuncture and Oriental Medicine, and I've been in private practice for over 13 years. And when you come see me, in addition to acupuncture, I do offer some other modalities in traditional Chinese medicine, including cupping phototherapy, and then targeted supplement use or life coaching as people may need. So, real quick, some frequently asked questions that I get a lot. Do you take insurance? I do not bill insurance, but I do help patients self submit if their insurance company does cover acupuncture. So, my fees are $125 for the initial visit and treatment, and then $85 for follow up treatments. And I do offer a $5 cash or check discount. People often ask, well, how many treatments will I need? Which it's, somewhat hard to say off the bat without knowing somebody, right? Because it is an individual basis. But for general guidelines, I typically say for acute cases, plan about 4 to 6 treatments, or for more chronic cases, anywhere from the 10 to 12 range. And typically, I see people once a week to start. So, how can we work together or you help me? Definitely would love if you recommended me to potential patients. Think about who's hurting in your life. Has anybody um, wanted a new treatment alternative, right? Or have had questions about acupuncture? Definitely send them my way. I also love to talk about acupuncture in this medicine. So, if there's any speaking opportunities at your office or for a particular group, definitely think of me because I would love to share more. But if there's more questions that I didn't have a chance to get to, definitely reach out. The best way to learn more too is visiting my website, which is balancedhealthacu.com. There is on my website, you can find an easy button to schedule online or the direct link to my online scheduler through the Jane app is here. Also on my website, you can sign up for my newsletter. I try to send out a newsletter at least once a month, maybe twice a month, really educating people on different ways to improve their health. But you can also just reach out, call, or text me at this number. So thanks so much for your time. Definitely reach out if there's more questions, and thanks so much.